quality, affordable, appropriate, accessible technology in the Philippines. And this first opportunity towards this dream happened in 2000 when Cambodia Trust offered the prosthetics and orthotic course in our university. The partnership did not prosper because timing and logistics were not right and right. The second opportunity occurred in 2005 when Physicians for Peace initiated Walking Free Philippines. A 10-year roadmap was developed where Phase 1 revealed the 4 challenges of cost, accessibility, local sourcing, and professional training. The most visible strategy then was collaborative innovation and adaptation by utilizing donated components and doing island amputee screening and prosthetic service missions. Physicians for Peace prosthetists conducted biannual workshops with local technicians who still clamored for a formal course. 3 years into implementation, Walking Free failed to reach the finish line because prosthesis recipients were going to school and were economically productive and were joining marathons and mountain climbing. But we were jolted back to the realization that what we deemed was actually a victory rose into new problems. And we were stuck with the fact that what we really need was professional training in order to make it truly sustainable. And so Physicians for Peace sent me to attend conferences of the International Society of Prosthetics and Orthotics. And one fateful day in 2008, I met Dan Bloca, who introduced me to the regional program. And this time, the timing was right and the logistics was right. The Philippine School of Prosthetics and Orthotics of the University of the East Ramon Magsaysay opened its doors in 2010. Aligned with the UNCRPD, PSP was inclusive, with persons with disabilities actually engaged as leaders, trainees, and members of the advisory board that ensures availability of the 3A devices in underserved areas. Aligned with the WHO and ISPO guidelines, PSPO ensures that only the highest standards of quality shall be applied to every device. Collaborating with Physicians for Peace, Simon of Cyrene, and other providers that are in partnership with the Department of Health, Social Welfare, and local government, PSPO serves as an anchor for development and upgrade of prosthetics and orthotic services and medical allied health training. Cognizant of amputee screening through cellular networking as an efficient tool for grassroots screening and referral, PSPO linked with smart telecommunications and Ateneo to upgrade Ascent as a tool for monitoring prosthetic utilization. Only 2 years from its inception, the Philippine School of Prosthetics and Orthotics has made us achieve what we have been trying to achieve in the past 20 years. The Philippine Health Insurance Commission implemented in August 30 the Z Mobility Orthosis Rehabilitation Prosthesis Health Package because PSPO enabled compliance with the required professional standards. And this is the first ever benefit package for persons with disabilities in the country. As such, the Department of Health and Philippine Charities of States inked public-private partnerships for 3 prosthetic orthotic workshops. 2 multinational and 3 local companies are negotiating for business partnerships and microfinancing. And more importantly, our local government units are already actively enrolling persons with disabilities into the field health and collaborating with NGOs and GOs for eventual employment and livelihood. The UNCRPD Article 23, which calls for international cooperation for the realization of objectives regarding access to assistive technology, made all this happen in the Philippines. As a low-income country, having the right heart and mind is the ideal scenario to jumpstart assistive technology. But the best way to keep the gears going towards sustenance is global and local cooperation, collaboration, and linkages. Thank you.